He is cute.
What a good personality, man.
And he's now he's cute and he's feeling much better, which is nice to see. And that's actually post-surgery, which is so he'll continue to feel good. The fact that he's looking much brighter today is great. So, and this has only been up for a couple hours now. So
so you just want
absolutely. So Roland came in last night, picked up by Craig and his team. He was in. I guess was found in a situation where he was essentially just leaking blood from his penis when he was brought in here. He had electrolyte abnormalities, his liver enzymes were elevated, we suspect relative to or secondary to a reaction. He has a lot of bacteria within his urine as well, and we're waiting on a culture to come back. So last night when he came in, he was partially blocked secondary to all the inflammation that was occurring in his urethra. So his bladder was full, yet he was leaking some urine from his penis. He couldn't fully empty it. We tried to pass a urinary catheter. We were unable to pass that urinary catheter, unfortunately. So kept him overnight on IV fluids, pain medications, antibiotics, and ended up this morning sedated him, put him under anesthesia. Actually, was able to pass the urinary catheter. The reason that we couldn't pass it last night, which we found out today, is because he has prostatitis, which is inflammation of the prostate, prostatic cysts, and prostatic infection as well as the urinary tract infection. Because of that, there was so much, once again, inflammation of his bladder and inflammation of the prostate that was actually functionally obstructing him from peeing. And when we tried to pass a urinary catheter without sedation, unfortunately, it wasn't going in because of that, because of all that blockage there. This morning, we ended up taking him to surgery. He passed the urinary catheter, was able to get it in this morning, flushed everything out, took him to surgery, neutered him. Our thyrogenologist did an ultrasound, saw that the prostate looked the way that it did. She suspects that these prostatic cysts played a role in how severe the hematuria or bloody urine was last night. But with neutering, fluids, pain meds, and time, we should certainly see some improvement here. And we'll see if he's able to fully empty. The problem in certain situations is that we don't know his history full right now. If he has any other reason for this, what happens is that these guys can get something called an atonic bladder. Basically, if you're obstructed for long periods of time, your bladder stretches. And if your bladder muscle is not stretches enough, the nerve roots won't, or the muscle won't contract, so the bladder won't function the way that it was previously. And hopefully that will not be the case with Roland. If that is the case, unfortunately, we'll have to express his bladder, and that's what happens. It's just manually expressing it so that he can empty it in full. Something that Craig and I had talked about yesterday. I know we've had other dogs in the past that we've done that with, but basically that's what that treatment would be, or that's how we would make sure that he's emptying his bladder in full, and that may just be a function of being obstructed, unfortunately, for longer periods of time. But hopefully, again, that won't be the case. Hopefully we'll be back to ourselves with antibiotics, anti-inflammatories, and he'll be running around playing in a wonderful home soon enough.
And what about the spinal bifida? He doesn't. So you said it wasn't spinal bifida.
So he's got something called caudal or sacral and caudal dysgenesis. So it goes in somewhat of a similar family of that, but it's actually a normal variant in certain bulldogs or in bulldogs in general, where their caudal and sacral vertebrae are not formed appropriately. Now, in certain cases, we'll end up seeing where it can affect the nerve roots. So if the nerve roots are affected because of this dysgenesis is too severe, it can end up impacting your the ability to walk in the hind limbs, which is walking very well, and potentially the nerve sensation to the bladder. So if the nerve impulse is the way that a bladder is going to function, is that it's got to get nerve sensation, and the bladder is a muscle, so that's going to contract, but it needs the neurological stimulus to contract. And if that's not contracting, or that stimulus is not making there, it's not going to contract. So some dogs with dysgenesis will end up not functioning well from a bladder standpoint. Majority of those, though, are not walking well. So that the way that the nerve roots come out is typically we're seeing neurological issues in the hind limbs, in addition to urinary issues as well. So those tend to go hand in hand. The fact that he's walking so well, we don't know his full history. Again, my hope is that that's not going to be the case, that he's going back to manually expressing his bladder. If that is the case, something that we can deal with. It's just going to take some help to allow him to pee. But again, something that he's able to pass urine, so that's the most important part.